Welcome to Skin Depth Convo. I'm Anna Kagarakis. This is a show focused on educating and inspiring all those in the skincare and beauty industry. Now, 2021 is finally here, and the skin and beauty industry as a whole has been tested and pushed to the brink in one of the most trying times that we have personally dealt with. But something that history has taught us is that beauty always bounces back. It's human nature. The medical aesthetics industry is kind of both open and closed right now, but there's a lot of excitement and new trends to look forward to in that market. And here to discuss, as always, are our two expert hosts, part of the founders of Lira Clinical, Metaxia and Francine Kagarakis. So excited to have you back, ladies. Now, we are going to be joined later by Brenda Cumming, who's also another founder of Lira Clinical. But let's start off the new year right. Happy New Year. It's 2021. We're looking forward to discussing Medi-Spas, trends in the new year. But let's talk about the difference. First off, what's the difference between an aesthetic clinic and a Medi-Spa?
That's funny you asked that question. We started back over 30 years ago. I won't give you the exact date. We started off working under a doctor, Dr. Bruce Cohen, a dermatologist in San Francisco. And that was, I would say, the beginning of Medi-Spas. It was basically a doctor, medical director in a clinic who would oversee the treatments and would actually set up with different procedures that were more advanced in aesthetics. For example, Dr. Bruce Cohen had his wife, Janet Cohen, who was an RN, and she worked under his umbrella. And then all of a sudden, estheticians became more part of that
medical world.
The business model. But, it really kind of changed back then when they were bringing in more of the retail products, more treatments, more peels as far as maintenance. So there was a shift back then. So the difference, a simple explanation is a Medi-Spa is directed by a physician who oversees and carries the liability, and he actually is responsible for all the treatments done within the clinic.
And I'd like to say Happy New Year to everyone, and we are so excited to be finally in 2021. And as Metaxia said, that was the first time we worked together, Dr. Bruce Cohen, and it was very exciting because it was a dermatology office that expanded into a Medi-Spa. And this is where you would get injections, you would get collagen injections, and you would get other treatments, you would get peels. But then the aesthetic part began to grow and grow and grow. And the unusual part for us is to see skincare come into the medical arena. It became very important. First, it was glycolic products, so then that the client would go ahead and use products that would help exfoliate their skin. And then we use sunscreen and certain other things. So skincare became very, very important in the Medi-Spa arena. It is one of the things that you need to make sure that your skin is healthy to tolerate all these treatments. Another item that we used in those days was something like hydroquinone. We would manage melanin before, during, and after treatments so we can deal with hyperpigmentation. So those were the type of things that we began many, many years ago, but today it's a lot more sophisticated than it was in those days.
Well, you make it sound, Fran, so easy. I think trial and error. I think when we first started, there was no internet in the office. There was no lasers in the office. Injections were something that were introduced back then. But I think with all the experiences and the trial and errors that we went through, understanding that skincare was a foundation of these treatments, understanding that you need to cleanse the face, not just with acetone, you need to hydrate the face because this face has been irritated, and you need to protect that face when it's exposed. And I think we've seen so much in the past of people not understanding it. And finally, I would say that we're 2021. I think this industry is really focused that you need good skincare. And I think it made its full circle.
Skincare is a huge part of the Medi-Spa arena, and it continues to be because good skincare is your foundation for healthy skin.
Yeah, I was just going to ask you, do you think that the professional skincare is the foundation for medical aesthetic treatments?
Absolutely. For me, I think that if you don't properly take care of the skin that you spend a lot of money to restore or to rebuild, you're not going to maintain that result. It's not one treatment that will fix or give you that ageless look or the glow. It doesn't happen that way.
You have to have that healthy skin. If your skin is dry, if your skin is inflamed, it's very difficult to do any type of treatment on that skin. So you first have to make sure to repair it, get it to a point where it can tolerate the treatments that you're going to be doing in a med spa.
Pigment, Anna, pigment. You can have a beautiful canvas. We call the epidermis a canvas. And if you have a canvas that is pigmented, it looks aged, looks weathered. If you have a canvas that has uneven ridges and it has enlarged pores, all these things will definitely not give you that beautiful look that you're looking for, because everything that the doctors are doing in the med spas, these procedures are based on working in the dermis. And what we're doing with skincare is working on the epidermis and getting down deep enough to the basal layer to introduce a healthier epidermis. So you cannot just inject in the dermis and expect the epidermis to give you this beautiful look. It really takes both treatments together, the home care, the skin care, the treatments together to make this beautiful finished look that they're looking for.
One thing we'd like to do is also to let people understand it is not complicated. This is a simple program. You begin, like Metaxia said, a cleanser. You're going to use a serum. You're going to use sunscreen. You're going to use hydrators. And then you begin to get conditioning treatments, which are treatments that begin to bring in products that help treat the skin. It is not complicated. And then when you go to a med spa, you can begin with something like botox, or then you can begin with fillers. It's not as complicated as people make it sound. The only thing I will say is once you do begin, it is very exciting to see the changes and to see great results and to maintain.
If you look at the generations now, we're more health conscious. I see that people are exercising more, people are watching their diet more. So it's gone even past skincare. If you really do drink enough water, exercise, watch what you eat, it really brings that finished look. I could tell you a 60-year-old does not look 60 anymore. A 40-year-old does not look 40 anymore. We've advanced in a way that we could actually be more health conscious and actually slow down the aging process.
Well, we have talked a lot on the show about bringing beauty in from the inside out and how important it is to take care of yourself. And that is a really important part. Everything does come out on the skin, your life, how you feel on the inside, your food.
Your stress shows on your skin. Absolutely.
And I think it's interesting how much you both have seen the evolution of this industry as a whole. So you've been around for a bit, and you know that it's got to be really interesting to see how the med spa has changed from your perspective.
I can tell you med spa started off with dermatologists, and then they went to plastic surgeons, and now you have a variety of different MDs and specialties doing med spas. It really has changed, but a good med spa, or in our opinion, in Lira's opinion, is one that supports good skincare that will finish and continue to maintain that result longer. I mean, there's a lot of med spas out there that just focus on procedures and not have that total package.
It's going to be interesting to see now with COVID-19 how things will change. So after this last year, we've obviously seen a big shift with, the world as a whole, but also this industry. And now med spas, do you think COVID-19 will keep patients away from treatments? And if it does, how long?
Well, I don't feel that they will stay away, because a lot of people who have already had the treatments need to maintain the treatments. And we are seeing more and more people understand these treatments and know what to ask for also at the same time. So I think you're going to see that once things begin to open up, you will see that it will return 100%. I think we're at 50% at this time, but ongoing, it is coming back.
It's our schedule. I think it's important to maintain the integrity of the epidermis and support it with different procedures. And I think Botox is a favorite of ours. I think some of the new techniques out there are really exciting for us. So I know that we're constantly looking on ways to keep our skin at that youthful state. And I can tell you it's less aggressive, and I don't see the facelifts out there. I just see more of maintenance and less aggressive treatments. And that's really exciting because you could really maintain your youthful appearance a lot longer.
Well, there's going to be a lot of excitement coming into this next year, and we're hoping it's going to be a great year for everyone and the skincare industry. We're going to talk a little more about it next with Brenda Cumming. We're going to go over all the trends for 2021 in the medical aesthetics industry. But before we dive in, let's have a word from Lira Clinical.
Lira Clinical takes today's skincare to the next level. Using cutting-edge technology and the best high-quality ingredients, Lira gives you brighter, healthier, younger-looking skin. With award-winning products, advanced education, and innovative skincare philosophies, Lira Clinical is redefining aesthetics and offering superior products and treatments that produce remarkable results. It's beauty from the inside out. Be bright, be beautiful, Lira Clinical.
All right, well, joining us for our interview segment, we have Brenda Cumming, another one of the 4 founders of Lira Clinical, who is also a registered nurse and knows all about the medical aesthetics industry. Brenda, thank you so much for joining us. I'm really excited to talk to you about the newest trends right now in this field. But first off, let's talk about you. How did you get into medical aesthetics?
I was reading my Nursing Spectrum magazine in like end of 2001, beginning of 2002. The biggest urgent care clinic up here in Evergreen, Colorado, was getting ready to close down for lots of reasons, primarily after 9/11 and HMO reimbursements. And it was getting hard for those docs to try to maintain all that. So I saw an ad that said, learn how to do microdermabrasions, chemical peel, spider vein therapy, and then this botox in the face. And I remember going, who's ever going to get that done? Closed the magazine, went about my business, ended up closing down this clinic, which was very hard on a small town up here. I mean, we were big, and, a lot of people depended on us. And I decided, I went back down to all the hospitals, and I have a critical care and trauma background. So I went back to the ER, went back to the ICU. I saw these girls running around with their hair standing up, and I was like, God, do I really want to do that again with 2 kids? The hours were terrible with 2 little kids, and the pay from Texas to Colorado was horrendous. It was insulting, really. So I thought, I'm going to try this aesthetic nursing. I'm just going to give it a shot. And I told the OR director at one of the hospitals here, I'm going to try this aesthetic nursing. And she's like, well, good luck. And by the way, I sent her Christmas cards for like 5 years, just kind of updating her on how well that went. So I maxed out a credit card. I flew to, where was it, Metaxia? San Mateo. I was in this hotel with these 2 nurses that really just paved the way for me to get into this industry, because nobody really knew what it was. And one of our modules was skincare. And I understood chemical peels. I fell in love with that because you could just change the skin so instantly. I really was skeptical about the cosmetic aspects of Botox, but in walked these 2 women named Metaxia and Francine and who knew in 2002? But I knew, I had a feeling. I just had a feeling when I met them. I don't even know what it was. I couldn't put it into words, but that just completely changed my life. And what I thought was going to be just a part-time job, opening up a little skincare clinic up here in Evergreen. And by the way, nobody was getting Botox in 2002 where I live. I had to go to Denver. I had to travel, but I just got obsessed with skincare at that point and worked sales for a skincare line for a while and met these 2 wonderful ladies, and like the rest is history.
Well, we're soul sisters, and we all appreciate how important it is to work in skincare and all the other things that Brenda does also.
It's really the base.
Well, I have to say that when Brenda came up to us and was talking to us, it was a connection.
Oh,
there was a connection right after that. It felt right. It felt that, she was curious. She really wanted to know more, but she was kind of figuring us out, and we were figuring out her. And it really became a family connection. I have to say, from back in 2002, there was something special about her. And together, I think these 2 relationships really began and grew into what we have now, a partnership. And Brenda is, not knowing, she is one of the Greek sisters. So,
and she makes sure that she's our mother's favorite.
Yes.
I am your mother's favorite. It's not making sure. I am.
Yeah.
Yes.
I flew back to California and I went to Aesthetics Plus back then. Remember, I emailed you and said I'm coming, and I ended up bringing some other people, and Metaxia gave us a day, which in hindsight now, I realize how valuable of a gift that was, because she's a very busy lady. And she just, the way she explained how peels work, and I don't know, I got it. I got it. But for her to give us that time, I'll always love you for that. But I figured it out. It was like, oh, I get it. This is what, I don't know. It was like that last piece of a puzzle just fit into place. Do you remember that?
Yeah.
And I know how busy you were. Your hair was probably standing up on top of your head, but she gave us a couple hours, and that was invaluable training.
Yeah.
More invaluable than anybody even realized.
No, I think what it is that, you guys came with open minds, and it was fun. It was fun really kind of bringing two industries together, because nursing was just so rigid, and it was different. And now all of a sudden you're really changing a people, their perspective, their skin, and you guys are just open with so many opportunities to learn more, and we're just more open to learn what you guys have to bring to the table. So I think it's a beautiful marriage. I think the nurses in the field out there, the aesthetic nurses, have done so many good things for the aesthetic industry. We're just very lucky that you're part of us, and we're part of you.
We're good learners. We just need some help. I mean, we understand skin, but we didn't really know how to work the skin.
There's a lot of changes that have gone on over the years from when you started to now in 2020. So, I mean, it's got to be a completely different industry, especially over the last year, and how everything has been affected now with the pandemic and everything.
She's considered one of the top aesthetic nurses in the country. So Brenda has done really, really well. This segment is about medical aesthetics. And there is so many opportunities, so many ways you could be successful in this industry. Are the Medi Spas open now? Can we come and get some services?
Of course. Yeah, they're open here, not at 100% capacity. And I think even if we were, I think a lot of us, until the vaccine is out, are going to, be respectful of that and be conservative. So we're at like 50% capacity, which is a lot for me because I'm not a big practice. But yeah, we're open.
And you really have to trust the person that you're going to get these treatments. And I do have to say, we do trust you quite a bit. But what are the trends now for 2021? What do we look forward to? What are we, not only just us, because we are looking forward to it also, but what is everyone looking forward to in 2021?
I think the trends for this year are pretty much the same as they have been. I mean, last year was rough. A lot of us were closed down, most of the nation, and many of us, not California specifically, but we got to open back up. And so people were just banging at the door like Mervyn's trying to get in. And the number one treatment still running and has been, is neurotoxins. The neurotoxins are still the most sought after, especially if you're wearing a mask. Lip injections, filler is big. And it has been big. And I don't know if it's just, bigger now, because if you get a bruise, you can hide it. Skin tightening, so non-surgical skin tightening, fat reduction with the ultrasound and radio frequency devices in those small, hard to treat areas is still really big. Laser hair removal is still big. Microneedling, different forms of microneedling, different platforms of that, still very popular. And I'm pretty sure that plastic surgeons are very busy right now, because how many of us are on Zoom all day long, staring at themselves at some point, hours, and starting to pick apart all your defects that you don't like about yourself. And they're coming in, and a lot of men are coming in because they don't know how to get that laptop up at a higher level. And they're coming in complaining about, their facial expressions or their volume loss in their face. That's been very interesting. I think neck lifts are probably, as far as surgeons go, I would think that's a hot topic right now.
What's the age of the men coming in?
I would say 40s and up. They've been slowly coming into this field, but we up here have experienced a surge in the male client.
Notice on TV, there's a lot more of the commercials for the derma fillers and the Botox and the procedures out there, and they're pretty young. What's the youngest you've seen in the female category?
Well, I had a 18-year-old girl who came up with her mother because she noticed that one eyebrow was slightly lower than her other eyebrow, and she wanted to look good for her senior pictures. And her mom's a friend of mine, and she really had to talk me into that. And she ended up getting just a microscopic dose, but it did fix her eyebrows, so she was happy with her pictures. And as soon as they can sign their own consent, they want to come in, they want to get their lips enhanced. I have a lot of mid-20-year-olds who are getting married and they want to look good for their wedding pictures, and maybe they have some lines on their forehead, a little Botox, just so they look good for that day. So definitely the 20-year-old demographic is becoming more interested, and if they feel like it's maintenance and preventative at their age, which I can respect that.
Have you ever said no?
Oh, I've said no lots of times. I've said no when they show me a picture of what they want to look like, and it's nowhere close to, it's not possible. Someone who has like 0 lips wants, a Kardashian lip. That's not going to happen. I'm not going to do that. I'm not comfortable with that. Everybody's my billboard. So I don't need people going out saying, oh, Brenda Cumming did this. And they're all like, oh, I want people to say, wow, you look really good. And they don't know why.
Yeah.
That is a compliment to any nurse injector, any physician who injects.
So what do you do with people who have there's different types of lips, obviously. So you have people who have just want their lips to be a little bit more enhanced. And then people like me who have basically no upper lip. So what do you do when it comes to fillers, and how do you address those type of lips?
Well, we start slow and build a platform. So you will have some improvement if you don't have a lot of a lip or a lot of lips show, but you're not going to have big full lips unless you go somewhere and see somebody who would try to do that on you. Mm-hmm.
How long does it take to finally get some type of lip?
There's a lot of factors: the age, what that lip really looks like, what you think the outcome is going to be. But I usually start with like a half of a syringe, try to get that tissue to expand, get that tissue used to it, and then add more. But it's not going to be a process that's going to happen in one session. I'm not going to put 2 syringes in somebody's lips who has no lips the first time I ever see him. But we'll work our way towards that.
That's true. And that brings us back to that trust level. You need to trust the person who's injecting you and who's doing your treatments to make sure that you're both on the same page.
Correct.
Yeah. And how about sagging skin? I hear there's some new treatments for sagging skin.
So sagging skin, if there's a lot of skin laxity, honestly, they're best, send them to a facial aesthetic surgeon, get their opinion, get a consult from them, because no amount of filler, no amount of threads, I think we're going to talk about threads, is going to help with a lot of loose skin. If you can pull a lot of loose skin, it needs to be cut and pulled. If there's a small amount of skin, or you want to try to tighten that up, you've got your radio frequency devices, and then you have thread lifts. So there's 2 types of threads. There's smooth threads that act like filler. So it can help stimulate, it's a microscopic wound. It can stimulate a collagen rush, or you can get the barbed threads.
How do those work?
With the barbed threads, you can insert them right into the hairline above the ear. They'll go down almost to right along the marionette line, which is right below your mouth. You can insert them above your jawline. The purpose of the barbed threads are going to stimulate a lot of collagen production to that area. Once you insert the barbed thread, you twist it, you pull out the cannula, and then you pull. You can literally pull the skin back, you cut that barb, massage it up, and your skin is tight.
And that can be done in the office?
Yep. So it's fabulous. It's great for really any age group, as long as you're the right candidate for it. So about 15, 20 years ago, it was considered kind of a surgical procedure. It is a non-surgical procedure. You're still, invasive, like you're making an entry point, but they used to do it in the OR, and they're not anymore. It's hugely popular right now. It's all over Instagram. You guys probably see pictures of it where somebody's got 60 needles in their face. That's overkill. You don't need that much.
Right.
For the smooth threads, under the eyes, between your brows, where your frown lines is another alternative. Well, in addition to Botox, you can put the threads there. If you don't want to put filler in those deep lines, that's also a very dangerous area to put filler. You can put them around your mouth. You can put them in the lips. I don't think there's a place on your body that you can't put a thread.
Interesting.
So it definitely has a place. It's definitely very popular, but it's usually in conjunction with filler and neurotoxins.
How old is this treatment for the threads?
Oh gosh, threads have been around. They've been around for a while. They were really popular about 20 years ago, kind of died off, and now they're hugely popular again. And most of the best threads come out of Korea. Right. Then they go to Europe, and then they come here once they get approval. But it's big.
Now the lasers, I'm really kind of reading a lot about lasers. They really have changed too. There's a lot more advancements with lasers. Can you tell me a little bit about that?
I think the key to lasers is less invasive and no social downtime.
Yeah.
Right. So IPL, which is not really a laser, it's more scattered light. We'll go after red and brown and some fine lines and wrinkles. That's definitely a no downtime treatment. That's one of the best devices to treat, the hyperpigmentation, diffuse redness. And then they have laser hair removal, which continues to be one of the most requested treatments. I thought that trend was going to kind of die down, but I'm very wrong about that. So laser hair is still big. And then now they're getting into a little bit more ablative type treatments, like Cartessa Aesthetics has devices that are sublative. So there's like a tetra laser that's going to affect the epidermis a little bit more aggressively, but not have that downtime. Like the old CO2 lasers, where those were really only indicated for what type of Fitzpatrick 1 and 2, basically. And now, they're trying to get into treating higher Fitzpatricks, not necessarily, 4, 5, and 6, but there's definitely a place for it. And at that point, you're going to look at microneedling and maybe microneedling with a radio frequency, the energy behind it.
Because I'm seeing that there's a series of laser treatments now that they're proposing. So it's not just one laser treatment.
Right.
It's a series
Right.
with other modalities like the POs and like
Sure.
good skincare to support it through. But it is a series of progressive, not aggressive treatments. So
Right.
I've seen a couple people that have had laser treatments and they look perfect.
Mhm.
They go right back to work and their skin is definitely, the textures change and the firmness is there. So it's amazing how it's changed over the years.
Oh, yeah. That's the key thing that you said, is that going back to work and the social downtime, because no one wants that.
Right.
And I don't really think I can name anybody who's willing to take like a week off and having a big laser. And actually the old phenol peels and the old CO2 lasers, you weren't just off a week. You were off for weeks.
Plus the hypopigmentation concerns, there was definitely an incident of more hypopigmentation under that bricking, that stamping that you find, the old lasers.
Yep. Yeah, the devices have become a lot more sophisticated and for treating the skin and getting results, definitely.
So then how important is it to have healthy skin to really tolerate all these treatments beforehand?
You can come in and spend thousands and thousands of dollars to get, neuromodulators, fillers, threads, all kinds of things, and not have good skin. So in our office, I feel like we're doing our patients injustice if we don't get their skin in shape. And we're really being strict about that right now, because we're making a lot of our patients, or strongly encouraging a lot of our patients, to go through their laser treatment, and then they can see myself or Cindy, my other nurse, and get their filler and their botox, and just kind of keep adding on to that. And just because to me, that's like the icing on the cake. The skin is the most important, and keeping that integrity and, getting rid of their brown spots, reducing their redness, reducing their fine lines and pigment.
Where does somebody begin? Because all of these treatments can be confusing. And so when you come in, you don't want to be overwhelmed, but you want to have a starting point. Somebody who has pigment but sagging at the same time, where would you begin?
What is their chief complaint? What is their primary concern that they have? I'm going to begin with what's bothering them, at least as a conversation, because they came in to see me for this, but I'm looking at like all their pigment. It's going to come up in the conversation, right? Okay. And Botox aside, sure, I could address a couple of units to stop them from frowning, but we're going to address their skin issues. And I even have a sheet in my office that really is basically a picture. And if they're a new patient, they fill out, what bothers you, and they just start checking everything. And there's your conversation starter. And that's how you come up with your treatment plan. Okay. And if they have skin issues, we're going to start there.
Perfect. So you do start with a lot of skincare at the same time.
The main thing I'm going to start is, what are you using at home?
So how important is home?
And again, oh my gosh, I'm still surprised with all the information out there on the World Wide Web that people, you got to look at where you live too, but people want like natural products, or they're sensitive, and what is their definition of, I could spend 30 minutes talking to somebody about their skin and what they're using at home. And, we start talking about the difference between an over-the-counter product versus a cosmeceutical versus what really is a prescriptive product, which really it would be like Retina A, but gosh, that's over the counter now. And we just have that big discussion about, what they're using at home, because 80% of what they're using at home impacts their skin or affects their skin. And if they're not using a professional product, then that's a huge opportunity for me to educate them on getting them on proper skincare and proper home care. And they're going to see lots of results very fast.
Brenda, what do you feel about Retin-A?
Well, Retin-A was invented 50 years ago. And it's still, to me, in my mind, one of the best anti-aging products, but a lot of people can't tolerate a prescriptive Retin-A because they don't use it right, or they get red, they get overinflamed, their skin gets too thinned out, they live at altitude, they're not using it the right way. So you have to encourage them to use it the right way. But there's other products like retinols on the market that are definitely a little bit more progressive than aggressive. So those are usually my favorites.
I think the good skincare balance is really important, because Retin-A became so popular that we saw a lot of patients coming in with raw skin because they were just overusing Retin-A, thinking it's going to take away the wrinkles.
Yep.
What it did is just strip the epidermis to the point that the skin was dry, volume loss. So I think Retin-A in combination with a good hydrating product is a balance, what we're looking for. Because with all these treatments we're talking about, it comes to the actual epidermis, the health of the epidermis, and you just can't do one or the other. You got to get a nice balance between exfoliation and hydration. And I think these treatments that we're talking about also need to have that understanding that you just can't do one modality. It's a combination of multiple things. It is the peels, it is the home care, it is the dermal fillers and the Botox, but there is definitely a treatment plan that a good esthetician or nurse practitioner can actually put together and make it really specific for that patient.
And easy to understand, because all these items become overwhelming. And when people hear all the things they have to do, they sort of back away. So we do have to make it simple and let them understand that there's steps to take that are easy, and they're going to begin to see changes in the beginning. And then once we see changes, then it's more exciting to go to the next level and the next level, because now that trust with your practitioner is going to change everything.
And the overwhelming part, you're right. They get overwhelmed so fast. So it's not going to happen in one treatment. So it's my job to give them a treatment plan, because if I don't give it to them, they're going to go somewhere else.
But Brenda, what they're hearing in the industry, the old stuff, is that one laser treatment was enough for the year, or one strong chemical peel was enough for the year, or one Botox visit is enough for the year. It really is a lot more. It's a lifestyle, and you cannot get that youthful appearance, or you can't keep that skin, that glow, if you just do it one time. It's like brushing your teeth. You can brush your teeth, but you got to do it on a daily basis. You got to be able to be committed. And it's a lifestyle commitment. And I find that
maintenance starts at 35.
Yeah.
Sadly.
Yeah.
And it is maintenance. It is maintenance, because we're still aging no matter what.
Yeah.
Yeah.
Absolutely. And I like the idea, but they have to have results that day to keep coming back.
You got to give them a wow. You're right. You're right, Brenda.
And you've got to give them a treatment. It's going to be a skincare treatment. It's going to be a hybrid peel. It's going to be something to excite them that day where they're seeing a difference, send them home, and be able to use products to let that skin be healthy. So then we can ask for lasers and threads, Botox and fillers, but not all at once, but different steps. And then suddenly, it's a masterpiece at the end.
Yeah, you don't do laser the first time you meet somebody.
Right.
You don't know enough about them. You got to figure out what their skin type is, what their lifestyle is. But you can do, a nice hydrating treatment on them, a nice skincare treatment on them, and get them on some home care and have them come back. Absolutely.
And I think that's very exciting, because once you brighten and hydrate my skin, I cannot come back. I cannot wait to come back to get some threads. And then, a lot of wrinkles around the eyes and what's going on with the forehead. It makes it easier. I feel it's a lot easier because you begin that trust level, and then it's much easier to come in and get more treatments as needed.
Maintenance is important. And I have people who are in their 70s that are still working, and they want to look good. They don't feel their age. They're like, I don't know how I'm 70. I don't look 70. I don't act 70. And I'm going to help them with that.
Well, maybe that's because they've maintained for so long, done a really good job, had their good routines. They started at a younger age, starting those routines up. And
it does pay off, Anna.
It does pay off. Another thing that I've heard about, I've seen it gain a lot of attention lately in the sports world, is PRPs, or the platelet-rich plasmas. How popular is that in the beauty industry?
It's popular. It's been in the industry for a couple of years, but I think patients like the idea of having their own growth factors. You know, you draw their blood, spin it down, and then either re-inject the growth factors into their skin or microneedle it into their skin. And that will rejuvenate their skin and make them look brighter and more luminous, kind of feed their skin.
But first you wound them before you put it on, correct?
Yeah, you can needle them at different depths, microneedle, or do like our green power peel. That's another form of mechanical microneedling in my mind, or use the Virtue with microneedling and radio frequency behind it, and then add their own protein-rich plasma right on top.
We were in Australia, the three of us, actually a year and a half ago, and doing a training, and we met Sean, Factor 4, and it was incredible what he was doing with that. So definitely, there's a lot internationally that gets, it started internationally and comes over here to the United States. So I think that the PRP is becoming more popular here in the States with a different spin on it also. So it's really cool.
And Sean's skin
People like
looks
it
great.
in their joints. They like their hips injected, their knees injected, and that kind of regenerates or staves off, a knee replacement or a hip replacement. So why not?
Brenda, when you do the PRP, how long after can they, go back to their regular home care?
Oh, a couple of days, usually about 3 days. I don't want them using any kind of retinols or alpha hydroxy acids or anything like that. Just very reparative hydrating products.
So post-care for about a week?
No, 3 days, 3 to 5 days, once their skin starts turning over again.
How often can you do it?
We usually do it like every 4 to 6 weeks.
Okay.
A series of 3, depending on what you're trying to achieve.
Now, Brenda, do you ever send your clients home or your patients home with pro pads to condition their skin before they come in for their treatments?
Oh yeah, home care peel.
Okay.
It's the best. It's a peel at home.
And how often would you tell someone if they're coming in about a week to have a treatment, how often should they use their pro pads prior to coming in?
Depending on their skin type, I have them maybe start 2 times a week at night, maybe 3, depends on, what they've been using, what they've had done, how sensitive they may or may not be. But, our pro pads they pack a powerful punch. So I don't want them to go home and use them every night. They have to start out and build up to it.
I love the fact that you could take it from the jawline down to the décolleté, to the
Arms,
hands,
legs, neck.
legs.
Yeah, they're amazing.
So Brenda, how important is sunscreen with all of your patients?
Sunscreen is if they were only going to use one product, it would be sunscreen. It's the number one anti-ager, correct?
Absolutely.
So very important. And actually, kind of people are a little bit afraid of me up here because if I see them outside or I run into them on a trail and they don't have their hat on, or I catch them not wearing sunscreen, they're going to know how I feel about that. You can ask anybody up here.
Now with COVID-19, what we're looking at now is a lot of people are hearing about that 19 pounds or whatever. We're all being a little more body conscious. Are there any trends for the body this year?
Well, they want to lose their COVID-19 weight, right?
Yes.
And then I've had some patients who've actually took this time off to reflect and become healthier. It's been interesting. I've seen both.
Where would we start? Here we go. Now we need to start
we
somewhere.
have the non-surgical, fat reduction devices that are out there, and they're hugely popular, but it's not going to reduce 19 pounds of fat. So the True Sculpt or the Cool Sculpt and some of those devices use ultrasound technology, while the True Sculpt does, where it heats up that fat cell to apoptosis. So it basically explodes the cell, and it will reduce that fat by 25%. But the nice thing about True Sculpt, it has that radio frequency behind it, that energy. So you're going to get that skin tightening. So if you have small areas that are hard to reduce, you work out, you go to the gym, you got these little pockets, that is the answer, rather than getting liposuction, which is invasive and you need general anesthesia and it's going to suck out the fat. Best correction, but a lot of people don't want to go through that.
Do you talk about lifestyle quite a bit with them before they start these treatments, about walking?
We weigh them, measure them, and we set up realistic expectations. So if you're going to come in and spend a couple $1,000s and get your True Sculpt on your abdomen, but you're still not eating very well and maybe drinking more than you should, not exercising, you're not going to get those results. But it does work. It's great for under here.
Oh,
Great for
underneath
under
the
here
chin.
if there's fat.
Your
Help
chin.
tighten up in here.
Oh,
Help tighten up a little bit here on the arms and between the thighs.
The chicken
Yeah,
wings,
it's
right?
small areas, and it's all about,
yeah.
yeah, and it's all about realistic expectations.
well, sounds like I need a body wrap.
And you know what? Not just that, but people who are exercising and taking good care of themselves. I mean, we're still aging from here down. So, oh yeah, we can do all this stuff here. We can do all this here. Our décolleté, our arms where we're crepey, or our thighs. Well, we all know. So that's how much I love those Pro Pads.
Yeah.
Do you ever do body peels on your patients? So we start them off before we do these treatments?
Yep.
What's the
great.
most popular area? Is it like probably like the back of the legs? What's the most
The
popular
arms
area?
right here, the arms, the chest, the thighs, the legs, and we're so dry. We are so dry here that, yeah, body peels are great because we're dry.
So you also must be selling some firming lotion, Lira Spa firming lotion. How does that work under the arms too? When you're doing these treatments, you send them home so they have post-care treatments at the same time so we can continue the
Absolutely,
effects of tightening.
absolutely, because we're doing a lot of the work, but I love that product.
Great to put it on right before you take a walk, put your music on and go.
That little
Mhm.
tingle, that cold feel that you get, right? With the
Yes.
cream.
Product.
After a shower, when you put the Pro Pads on and then the firming on
Ah.
top of that, that's really cool. You feel like it's definitely the cleansing part of it, and then actually you heating it up with the shower and putting on that lotion. It really does really nice.
Well,
too.
even our spa cleanser.
Yes.
Oh, yeah.
That starts the exfoliation process right there. Then dry off, put those Pro Pads on, the firming lotion.
I do have to say also our body scrub is awesome.
Yep.
And if anybody's doing in clinic, we even put some of our lactic peel in that body scrub on the body. That's great.
I do.
Oh yeah, it's wonderful. And then put on the firming lotion. Yes. And then our wonderful oil with hemp seed oil. Fantastic. And our
Yeah,
souffle.
'cause who wants to have a face that looks 20 years younger than the rest of your body?
Not good. I can tell you what I find is that if when you take the body as a whole and not just treat it from the décolleté up, it's a full package. Because the worst thing is when as the weather changes, we could expose those legs when they're dry. And just dry. I mean, just putting on the exfoliation, putting on the firming, and then putting on the oil. There is a glow to your skin. Your skin, the extremities are the last to really hold hydration. But what a difference when you put a sandal on. What a difference when you expose your arm and your legs. It is a full package. And I think a lot of our estheticians are focusing only on the face, but broadening their perspective of really the treatments that they could offer. The body is really, really important.
Yeah, going back to threads, we do a lot of smooth threads in the lines here.
The chest area.
A little microtox here. I call them crinkles, to
the
just
chest.
happen to be endowed here, and you sleep on your side. As you always say, Metaxia, that skin's a memory. Nobody likes that.
That's right. Okay. So how about the knees? I thought maybe the threads, anything on the knees?
Oh yeah. Actually, I did
Ooh.
my nurse's knees in October, and we did a bunch of threads right above the knees to help tighten that up and get rid of that, whatever that is going on. When you look down, you see that.
I don't know, and I don't think about it, but I just think about threads and I think, oh, there's a light at the end of the tunnel.
Yeah. I don't think
That's
there's
a
a
new one
place
looking
in
at.
your body that you can't put a thread.
Sure.
One of my girlfriends in Houston she's a thread queen, and she has a patient who, I'm not saying names, but comes in and she probably works on her for 3 hours and does her entire body, even her buttocks, the back of her thighs. And then she gets on a plane and flies to Hawaii and recuperates because her boyfriend doesn't know she gets that done.
How many threads could you do in a sitting?
Any as you can tolerate.
Hey,
I need to open up my books.
yeah, open up.
I wanted to
3 hours.
mention when
seriously.
we were talking about body that one thing I like with the threads is on cellulite, because you know how it's ropey and it's a disorganized collagen formation. It doesn't matter if you're 80 pounds or 500 pounds, if you're genetically predisposed to it. But if you put some threads in that ropey collagen, it helps smooth it out. It's good for acne scarring. It's great for acne scarring too.
Wow.
Yeah,
These threads are miracle
I
workers
do
here.
like threads.
I do. I mean, you're introducing a wound, you're creating a wound, and your body's rushing to heal it. And they're putting all kinds of cool stuff in those threads. You know, they're working on some that kind of mimic Sculptra. So that's pretty exciting.
Well, looking at what we just discussed, it's a full circle back to skincare.
Yep.
Because without the proper skincare and the hydration and that beautiful, flawless type of skin that we're looking for, all these things won't have the maximum benefits that we're looking for. So home care is really important. And we're finding with the pandemic we're going through, people really are doing more treatments at home to support whatever we're doing. So it's important that we understand that it's a two-part type of treatment in the clinic, and then home care to support the in-clinic. Like you said earlier, is really getting a lesson and going home and doing the homework to support the lesson.
It sounds to me like it's the beginning part of the treatment when you go to a Medi-Spa, but it's also the end where you have to finish, polish it, protect it. So it is a huge part of the Medi-Spa world.
And we're hoping to see a lot more great news coming out of the Medi-Spa industry. Hopefully more people will be coming back and doing that. Already we're seeing the growth, I think, coming into the new year. But, you know, one of the biggest questions that we're actually getting here at a Skin Depth Convo is those who've had derma fillers, and should they expect side effects when it comes to the COVID-19 vaccine, specifically the Moderna vaccine? We've heard that in the news a little bit, that there's been some people who've had an adverse reaction. But what are your thoughts, all three of you, on the COVID-19 vaccine and derma fillers?
Get your vaccine, because derma fillers are elective. You can have a reaction to derma fillers whether you're getting a vaccine or not. I mean, that's one of the side effects is swelling. That particular Moderna vaccine had 3 people out of several thousand that reported an incident. So I don't really find that concerning. If my patient is concerned, then we will hold off the treatment rather than them holding off the vaccine. What's more important?
Keep everyone safe, get everyone back to work, and, you know, get life back to normal, if any, you know, or the new normal, whatever that may be. But we're excited to see that this industry is going to continue going, and this industry is still going to be doing well. And there's actually a lot of expectation that the beauty industry is going to grow exponentially in the next few years. So what's your expectations for this next year, Brenda? Before we go, what are your expectations over the next year or two for the medical aesthetic side?
So, well, none of us were around, but in World War II, women were saving money for what? Pantyhose and lipstick. It's
right.
Botox still. You know, this industry is going to do nothing but grow. And mainly because, you know, we're living longer, we're looking better. We don't look our stated age. We're taking better care of ourselves. It's just not going to go away. I think we definitely took a hit this last year. And I think some of the industry experts have predicted that it was going to be about 2.8 years for us to recover. But in my humble opinion, I don't think it's going to take that long.
I agree with Brenda. I feel that as long as people see results and they're happy with their results, they're going to continue to purchase and buy and get these treatments. It's very important.
Yeah, I got to agree with both of you again. People are working longer too.
Yes,
People
we
are
are.
not retiring at 60, 65. So, you know, we're out there in the workforce. People are looking younger. They look better than they did in their 50s. So yes, I think there is definitely a surge into all the new treatments and lasers and peels. People are just now more aware of it, men and women. The age groups are from young to old. So yeah, the industry is not changing, but growing.
Very important to think young, and stay positive.
Well, if you think young, you act young, right?
Yes.
The key thing is, you have to look young too. So you could think young, but you got to look young, and looking young is really being, you know, healthy. I mean, taking care of your skin, taking care of your health. But people were not wearing sunscreens. People were not exercising. Now this whole year has given for us a chance to reflect and kind of correct some of the things that we took for granted. So being home, like you said, the Zoom meetings, people are more aware of their face now than they've ever been before. Look at us. We're here talking.
We're talking via Zoom right now.
It's hard being on these all day long.
Yeah.
Gotta look good and make sure right filters. No,
It's all right. None of you need filters. You're all beautiful.
We
All
don't
of
have
you are
filters
beautiful.
on.
There's no filters.
no.
Just gorgeous, all gorgeous faces, and you have all maintained very well because you're all young. You think young,
Thank you,
are
Anna.
young. All right. But thank you all so much. Brenda, thank you so much for joining us to talk about the medical aesthetics industry.
It was fun.
It's really been a lot of fun. I love having the three of you chatting and everything because it's just fun getting you all together. And if you have any questions for anybody on the show today, you can email your questions to skindepthconvo@lyraclinical.com. That's skindepthconvo@lyraclinical.com. And thank you all for listening to Skin Depth Convo. I'm Anna Kagarakis, and we'll talk to you next time.